How long do I have to stay in the tube?
There's no time limit on staying in the tube. You're going to want to let pain be your guide for moving out of the tube, and that's for weight-bearing movements. So the patient would be allowed to move out of the tube immediately after surgery with non-weight-bearing movements like such as hygiene, scratching your back, and things like that.
Is it okay if my husband mows?
Ooh, that's a good question. It is. I would recommend starting phase 2 before mowing. That way we can have him supervise and measure his exercise capacity and strength before doing that, and then we can give a better recommendation on a start date for the mowing. And the key thing with the mowing too would be staying in the tube.
My bedroom is on the 2nd floor of my house. Is it safe to go up and down the stairs?
Absolutely. I would recommend asking your nurse or therapist to maybe do some step training while you're in the hospital. Obviously it's different for everybody. You want to do one step at a time, and helping yourself up with a handrail, keeping it in the tube.
Can I ride my Harley Davidson?
You will be able to, probably not immediately. That's a great question for the doctor, and we could leave it at that.
Okay. Can I ride my bicycle outside?
Yes, I would love for you to ride your bicycle outside. Avoid the hot times of the day. Make sure you're hydrated. And again, I would say wait until you start that phase 2 program, which you'll be going over there in a couple days.
Is it okay for me to swim right now?
Not until the incision is fully healed. And with swimming, the movements might be out of the tube, so we would want to make sure when we do go in the pool that we are in the tube.
Is there any amount of weight that I can't lift? She's like at 21 questions here. This is not easy. We're going to be here for a while, so
okay,
just relax.
So
Is there any amount that I can't lift?
Well, I wouldn't recommend you to go lift 50-pound dumbbells right away. You are probably the best person to measure your strength right now. There is no weight restriction when you are moving in the tube. If you're going to lift something, I wouldn't start lifting heavy weights or boulders or flipping tires yet until you do phase 2 cardiac rehab.
Quite the commercial. My doctor told me not to lift more than 5 pounds. Now you're telling me that he's wrong. What should I do about that?
And you're going to hear that a lot, maybe from other patients who have had surgery in the past, or other out physical therapy places or whatever. But we are implementing this move in the tube, and that's old data. I mean, there's nothing that says that you shouldn't lift over 5 pounds. If you weren't going to do that, you literally wouldn't be able to leave your room in the hospital, because that would take 14 pounds to open that door.
Excellent. My doctor told me not to lift more than a Dallas phone book. I live in Garland. Is it okay if I lift a Garland phone book?
I love that question. Absolutely. Keep the upper arms close to your body, elbows in, and then you'll be fine.
I want to be in a dart tournament next week, but my wife doesn't want me to go. Is throwing darts okay?
Yeah, that's it, in the tube. Right here.
Excellent. Is it okay for me to work out on an Airdyne bike?
Airdyne bike. Let me see. Yes, without the arm movement until you start that phase 2, so we know that you're pain-free and you're good to go with that. But I mean, if you have some delays in the phase 2 and you don't have any pain when you're doing the Airdyne with the arms, I'd say go for it.
How am I going to clean this tube that you give me?
Oxyver wipes.
But it has to stay wet for 1 minute.
There is no actual tube. Let me just make that clear.
I train horses. Is it okay for me to ride my horse right now?
I would recommend no, just in case, because if there were to be an accident and you fall, that your sternum is not fully healed yet, and that could actually cause some damage to the sternum. So I would hold off on that for now, probably about 2 months.
My husband loves to mow and he has a riding mower. We have a 10-acre farm and the ground is bumpy. I understand that riding a mower is in the tube, but will the bumpy ride have a bad effect on his sternum?
That's a great question, and I don't know. I think he'd be okay.
Can I walk my dog when I get home?
Yes, please. Increase that physical activity. You definitely want to be walking. That's the best type of exercise for you right now. Again, avoid the hot times of the day. Make sure you're hydrated. Probably have someone with you the first time, and just measure how you're feeling. You get shortness of breath, you're a little dizzy. Stop until it subsides.
I had a friend who had the same surgery and reached down and picked up his grandkid. He popped a wire and had to go in and get another surgery. I think what you're telling me is insane, and I'm going to follow what my doctor told me. Is that okay?
Absolutely, you can follow up with your doctor. Just know that patient most likely moved out of the tube when they picked up their grandkid, such as a movement like this, all right, and that would put excess force on the sternum, and that was most likely why that patient dehissed.
I work on an oil rig out in Galveston Bay. Is it okay if I go back to work next week?
That sounds like a very physically demanding job, unless you're a supervisor or something where you're sitting on your tush all day. So I would recommend telling that to your phase 2 interview again within the next couple of days, and they'll be able to simulate exercises towards your work and your profession, and that way you'll know that you're safe to do it and confident, and then they'll be able to give you an exact start date.
How long do I have to wait until I can have sex?
That's a good question. Shouldn't have to wait. It could be immediately. Just move in the tube.
My mom reached out of the tube yesterday to get a Kleenex. Do you think she may have broken one of her wires?
No. Patients are allowed to move out of the tube immediately after surgery for non-weight-bearing movements, and a Kleenex would be a non-weight-bearing movement. The human arm weighs about 6 to 10 pounds, so a Kleenex would have no impact on that.
Is it okay if I sleep on my stomach?
No, not immediately. Side is okay, and back is okay. I would avoid sleeping on the stomach for 2 to 3 months.
My husband is an avid bodybuilder. He is devastated that he may never be able to lift weights again. That is why he didn't come to this class, because he seems depressed. What should I tell him? Do you think he can lift weights again?
I love it. I want to go speak to him as soon as I leave this room. Yes, it's going to be okay for him to lift weights. He'll be lifting weights within a week in our outpatient cardiac rehab program.
Awesome. That's it. Those are all